This is the Proactive Mindfulness podcast with Serge Pringle. This episode is especially for therapists. I will be exploring what it means to practice embodied therapy when the body doesn't answer, and how something important is happening even as the body isn't answering. Let's start with a situation many of us can relate to. You're sitting with a client. You ask a question to invite their embodied awareness. Something like, where do you feel it in your body? And instead of opening the space up, everything seems to tighten. The client goes quiet, or they start explaining, yakety yak, or they look away. Words come, but not from where you were hoping. Nothing dramatic happens, and yet something has shifted. Inside you, something happens too. Maybe it's a flicker of doubt. Maybe impatience. Maybe that familiar pressure, the sense that you should be doing something more skillful. If you're interested in embodied work, these moments can feel really uncomfortable. We're trained to value bodily awareness. We're taught that sensation can open doors that thinking can't. So, what do we do when that door doesn't open? We go on a trip. Is the client resistant? Am I pushing too hard? Am I not pushing enough? But what if this moment is not a failure of embodiment? What if it is already an embodied interaction, just not in the form that we expected? So I'm not talking against asking direct somatic questions. That can be really powerful. For many clients, being asked about bodily experience feels grounding, clarifying, relieving. But it's good to remember that a question that seems innocuous, just where do you feel it in your body, is actually not neutral. And so I want to talk about the assumptions that go there. We're assuming that just in the moment we're asking the question, the client can pause, turn inward, notice sensation, and put words into it. And all the while, they're under pressure, emotional or relational pressure. Wow, that's quite a bit there. Now, for some people, that's easy. But for others, it just is not available. And it's not because nothing is happening in their body, but really because too much is happening. When the question doesn't land, it's easy to misread what's going on. The client may seem to us way too cognitive, evasive, blank. And so, as a therapist, we may feel stuck or ineffective. So, it's good to remember that often what's really happening is much simpler. The invitation doesn't match the way that embodiment is showing up right now. So I'm pausing and just say it again. What's happening often is that the invitation doesn't match the way that embodiment is showing up right now. And so let's go back to revisiting the assumptions. Embodied approaches tend to carry some assumptions that are so familiar, we take so for granted that we don't notice them. We value a sense that we can have comfort with turning attention inward, that people can have tolerance for ambiguity, and and that people have the ability to put a name to some subtle internal states. So you and I have trained in these approaches, and so you have developed those capacities, but not everybody has. These are not universal capacities. Many capable, intelligent clients organize experience differently, especially people who are cognitively oriented, or people who work in a place where showing feelings would be a sign of weakness. Their nervous system put a priority on doing, monitoring, anticipating, holding things together. So they freak out, essentially, when we invite them to turn inwards. We do it directly, and there is a head front collision. And so instead of softening, they tighten. Yeah, we want them to soften, and they tighten. So this creates a mismatch in the room. As a therapist, we start to feel impatient or unsure. And the client may feel, without saying it, that they're failing at something that they should be able to do. So here we are, the skilled people, the blind leading the blind. So now I just want to say, this is not a critic of embodied therapy. I think of it as a refinement. And essentially, it shifts the question from why isn't embodiment happening to where is embodiment already happening? Yeah, where is embodiment already happening? And how do I meet it there? And so maybe backtracking a little bit to see what our assumptions are. And often we equate embodiment with conscious bodily awareness, feeling sensations, naming them, tracking their changes, all of which are very valuable, that I value, that you value, and would be very useful for clients. But what we seem to forget is that the tracking is one thing, but absence of tracking does not mean absence of bodily process. So there's still a bodily process happening, even if the client has no self-awareness and is not tracking or aware of it. They're still alive. Clients who say they feel nothing are often doing a great deal somatically. They may grip their hands, hold their breath, scan the room, speak quickly, freeze. You see them oscillate between urgency and collapse. They may also kind of managing the time in the session. So all of these things are certainly not absences of embodiment. It's great to see them as expressions of embodiment. In other words, If you have a preconceived idea of embodiment and you keep looking for that preconceived notion, you very often will see nothing. If you see what is happening with the assumption that, an alive person is embodied, then there is a wealth of information that's happening because embodiment is there. So when we rely only on the client's descriptions of sensation, we're really at a great risk of overlooking what is already alive in front of us. Movement, timing, tone, posture, avoidance, stillness. Wow, so much is there when you look for it. Embodied work does not begin when a client can name a sensation. It begins when we recognize that body life is already underway. Yeah. So in this context, you see what some therapists often call resistance is often a form of intelligence. It's the client's nervous system saying, this is too fast or too direct or too much. And so, seen this way, resistance is not in the way of embodiment. It is embodiment. It tells us about pacing. It tells us about safety. It tells us about how this system stays intact. When we push past resistance in the name of progress, we push too hard. We just want to get there. We want to get them to move. Well, we get the opposite of what we're hoping for. We get more shutdown, more agitation, and less contact. So instead, we shift gear. Working with resistance means we let resistance orient us, show us the way to the connection with the client, and let the client's process unfold in the way that works for the client. So we're not trying to overcome the resistance. We're actually grateful for it as an entry point into the client's process and into collaborative work with the client. Now, I've talked a lot about the client, but, let's talk also about body in the context of the therapist's body. In those moments, something's happening in my body as the therapist, in your body as the therapist, when we feel impatience, urgency, a pressure to help, or a fear of wasting time. Sometimes we kind of feel a blank. Sometimes a feeling of, I have nothing to offer. And so we get caught in a loop of judgment and essentially thinking that, these are personal shortcomings. And it's great to step out of that loop and remember that these reactions are not our personal shortcomings. They're part of the embodied field of the session. Yeah, yeah. My sense of being blank, my sense of feeling trapped in judgment, my sense of being inadequate is part of the embodied field of the session. So when that happens to you, it's great to remember that your nervous system is responding to the same dynamics shaping the client's experience. And so you're trying to get out of that loop by forcing yourself to get out of that loop or criticizing yourself or pressuring yourself. And when you do that, essentially you treat your body's responses as interference, something bad, something you should avoid. And you know what? When you do that, you lose valuable information. And in contrast, when we recognize these roadblocks as relational signals, then wow, they guide us. So it's great to remember that embodied therapy involves at least two bodies. Ignoring one of them limits what we can perceive. If you only try to live up to your image of what you should be, you're leaving yourself aside. And actually, unfortunately, the sad result is you're not there for the client. So maybe let's go back a little bit to the notion of waiting for an opening. Okay. We often in session kind of wait for an opening, and we have a preconceived notion of how that should manifest. A shift, an insight, a light bulb moment, you know, not that often that you see a light bulb appearing above the head of the client. Maybe a felt sense that finally comes into focus. And so we're on lookout for that. And, openings rarely work that way. They tend to unfold gradually and they manifest more in the quality of contact, some kind of implicit, intangible quality of contact than in any single interaction that you can pinpoint precisely. Of course, sometimes it happens. But even when it happens suddenly, if you look back or if you look at a videotape, you notice how there was something that was leading to it. So, what do we pay attention to? Softening comes and goes. Awareness flickers. The process continues, even when it is not named. And if you miss a moment, well, it doesn't undo the work. You don't have to necessarily see every second of it. Staying present is not eagle eye watching, but is more of that emotional presence. And that quality of emotional presence matters more than pure precision. And so, for the therapist as for the client, understanding arrives later, once the pressure to do something has lifted. For the client, as for the therapist, the insight can emerge after the session, once it is safe for it to emerge. And so we don't see our client just once, and it will build for the next session and for the rest of the process, taking the long view that there is a living process happening and we're tapping into it. So I want to just go from the notion of process to a phrase that is often used to describe experiential therapy. And we say, meet the client where they are. And I want to make sure that, that phrase does not in any way means being passive. It's anything but passive. It means tracking where aliveness is present. And as I've mentioned before, it not just aliveness when it manifests the way that we expect it to, but even when it doesn't look the way we expect. So be on the lookout for what's happening as opposed to having preconceived notions of what's happening and a check mark on yes or no. So what it does is also means letting go of preconceived ideas about what form embodiment takes. More than anything else, it means tolerating not knowing, staying with the not knowing. So it does not mean not having hypothesis. Of course, you can keep making hypotheses, but any hypothesis is something you test, and it may be true and may not. It's not, it's the opposite of having a certainty. Staying with the not knowing, tolerating the uncertainty. So that's a bit different from the kind of presence where, it feels good for the client, it feels good for us when the therapist is a reassuring presence, okay, projects a sense of knowing it all. There's kind of a fine line. It's nice. We want to be reassuring, but we don't want to pretend certainty that is impossible. And so staying present with the not knowing can feel awkward. You may not know what to say. You certainly may not know what to do. And so it's good to remember that the uncertainty you're experiencing at that moment is not a sign that you've lost the thread. It's good to remember that it actually might be a sign that something new is organizing. So you, and probably you and the client, are in that twilight zone where something is turning, something is shifting, day is turning into night, night is turning into day, and tolerating being in that zone is what makes it possible for something fresh to emerge. So maybe to come to an end with this, I want to go back to where we started. And the question asking the client, where do you feel it in your body? And so it's still a good question, but just that sometimes it won't get an answer. And when that happens, when we don't get an answer, it does not mean the body is absent. Of course not. It means it's speaking in a different way. It's speaking through movement, through timing, hesitation, urgency, stillness. It also is speaking through what happens in you, the therapist, as you stay in the relationship. And so I want to emphasize embodied therapy is not just about making the body speak, it's also about not leaving when it doesn't speak. This recording is part of the Proactive Mindfulness podcast, where we explore the process of mindful change. You can find more articles and videos on the website proactivemindfulness.com.